Choose the true statement regarding load deformation curve. A. Beyond the linear region is the plastic region, where decreases in deformation occur with minimal and nonlinear changes in load. B. The elastic region is the initial linear region of the graph where the slope corresponds to the stiffness or Young's modulus of elasticity of the material. C. The yield point or elastic limit is the point on the graph separating the elastic and linear regions. D. In biological materials, normal physiological loading occurs within the nonlinear region, and deformations near and beyond the elastic limit are associated with microstructural damage to the tissue. And the answer is C. The yield point or elastic limit is the point on the graph separating the elastic and linear regions. Explanation for this question is, statement A is true. Beyond the initial linear elastic zone is the plastic region. In this plastic portion, the material undergoes deformation with little or no proportional increase in load. The load deformation curve becomes nonlinear and plastic deformation occurs with minimal additional loading. Statement B is true. The initial linear region of the load deformation curve is called the elastic region. In this elastic zone, the material deforms proportionally and reversibly with applied load. Following Hooke's law, the slope of this linear elastic portion corresponds to the stiffness or Young's modulus, elastic modulus, of the material. Statement C is false. The transition point marking the end of the elastic region and beginning of the plastic region is called the yield point or elastic limit. The yield point separates reversible elastic behavior from irreversible plastic deformation. It does not separate the elastic and linear zones as claimed. Statement D is true. For biological tissues, physiological loading often occurs within the nonlinear zone beyond the initial elastic response. Excessive loading and deformations approaching or exceeding the elastic limit can overwhelm the tissue's structural integrity and cause microscopic tissue damage or disruption.